in cancer care. We're going to be talking about real treatments for cancer. We're going to talk about fake treatments for cancer, and also how it feels to be bombarded with recommendations for both of those things. And to discuss those issues, we have two people with first-hand experience of cancer and two people who've gone actively looking for cancer pseudoscience to discuss these issues today. So I'd like my panel to introduce themselves, starting at the far end, please.
Hello, I'm Crispian.
A little closer to the mic, if that's all right, Crispian.
Sorry, much.
Distance squared law.
I'm Crispian Jager. I've been involved with the skeptic community for, 14 or 15 years now. I was the co-founder, along with my skeptical accomplice, Dave the drummer, with the large camera back there, for the Hampshire Skeptics Society and Winchester Skeptics in the Pub. And back in the days when the Skeptic was a print magazine, the ridiculous centerfold diagrams that I used to stick in there. But obviously that's not why I'm here. I'm here because on the 8th of December 2015 I went to the toilet and pissed a whole load of blood and was diagnosed with kidney cancer. They did a quick scan and decided there was a large tumour in my right kidney, which they whipped out. And if it hadn't spread beyond the kidney, all probably would have been well. The survival rates for non-spread, non-metastatic kidney cancer is really good. Unfortunately, mine had touched the liver, and within 5 months, it had spread to my liver, throughout my lungs, my bones. Later, the MRI scan showed that it was in my brain as well, and I was given months to live. So obviously I'm still here against the odds, and I've obviously taken a skeptical approach and done my best to avoid some of the treatments that we're probably going to hear about today.
I'm Brian Eggle. I'm part of the team at Glasgow Skeptics and part of the team at Skeptics in the Pub online, and occasionally, irregularly write for the Skeptic magazine. But I'm here today because I consensually exploited my wife's cancer diagnosis for a skeptical investigation.
Hello, I'm Laura Eggle, Brian's lucky wife, and I'm a microbiologist at Glasgow Royal Infirmary, and I get diagnosed with breast cancer just over 2 years ago. Been coming to QED for a good few years, but this is the first time on the other side. More fun that side.
So I'm Alice. I'm by training I'm a cancer cell biologist, and I have been part of the Merseyside Skeptic Society for more than a decade now. So I kind of dip into various different pseudoscientific conferences and try and engage with people who are offering pseudoscientific treatments for cancer, and try to understand what draws people to those things.
Excellent. And I'm Michael Marshall. I'm the editor of The Skeptic. I work for a charity called Good Thinking Society. And in 2018, I undertook an investigation into the crowdfunding platforms being used to raise millions of pounds to go to quackery clinics abroad, and what happens to the cancer patients who give up their conventional treatment and follow those offers of hope in the way that the media never quite followed up on those. And we published that in the British Medical Journal in September 2018. And that's our panel to discuss that for today. So, Crispian, if I could start with you. You've told us about your diagnosis, but would you mind telling us a little bit more about your experience of cancer, of the treatments that you had, and your experience throughout your kind of cancer journey?
Yes. So once I'd had the operation and the scanner showed that the cancer had come back, I was referred to an oncologist at Southampton, and it was made very clear up front that the treatment they would give me was not a cure. It wasn't going to save my life. All it would do would be to give me a few extra months to spend with my family, which I accepted. Begrudgingly, obviously. The first treatment I was given was a chemotherapy drug called pazopanib, and I was on a clinical trial to measure the effectiveness of that, and taking a break whilst on that drug. And whilst I was on a break from that drug, my cancer progressed quite aggressively. So after about 9 months, I got into quite a bad state on that particular drug. They tried me on a immunotherapy drug next, nivolumab. But at this time, the cancer was pretty well advanced throughout my lungs. I was having trouble breathing. I had to have regular operations to drain the fluid from my lungs and regular blood transfusions. So the immunotherapy never really managed to get hold, probably because of the state that I was in at that time. I've not been at this stage recommended any non-evidence-based treatment, certainly on the NHS from my oncologist, and nothing from my GP. I can talk a little bit later about some of the stuff that I had outside of that, which is a little bit more scary. But when the nivolumab failed, I went on to my third treatment, which was another chemotherapy drug called cabozantinib, and that had a good effect. That knocked the cancer back for about 18 months. So I was in a pretty good state for a while. I was on a lot of morphine and a lot of steroids as well. And then after 18 months, that drug became less effective. The cancer started to outwit the drug, and it started to grow again on the scans. And at that stage, I went back to my oncologist to talk about what treatment options I had left. And I was down to one option on the NHS, which was palliative care. Fortunately, I did have, or I still do have, private health insurance with my employers, so I was able to re-see the exact same oncologist a day later in a private clinic, and he was able to put me on a new combination of drugs that they were trying, which was a combination of chemotherapy, which was axitinib, and an immunotherapy drug, which was pembrolizumab. And I started to pick up on that, and I was on that treatment for 2 years, and the cancer was shrinking every time I had a CT scan. And then after about 2.5, 3 years, the scans were showing no visible signs of any tumours left in. I had lots of side effects from those treatments. The last one was the immunotherapy completely buggered my pancreas. So I'm now type 1 diabetic, having quite a lot of insulin to keep me going. But when they discovered I was diabetic, they stopped the immunotherapy treatment. And 3 months later, I had a scan, and it still hadn't returned. So I've been off any cancer treatments now since November last year, so almost a year.
Wow.
So that's the good news with conventional evidence-based medicine, and I'm not saying that if everyone follows an evidence-based approach, they'll all be fine, because evidently they won't. I've come across numbers of other kidney cancer patients as I've sort of embarked on this journey, and I've made friends with them on Twitter and social media, and the sad reality is I'm the only one left from the cohort of cancer diagnosis from 2015 when I started. So I can't say do what your doctor tells you like I did and you'll be fine, but I'm sure it helps.
Yeah. And Laura, if I could come to you next, in your own cancer experience, do you see any similarities? Is the story similar in ways to Crispian's, or what was your experience like?
Mine seemed a bit more straightforward. I found a lump in my breast, and I did the sensible thing and ignored it for months. I was breastfeeding, so I just assumed it was it's very common. I was young, I was in my 30s, in the past I'd had a lump in my breast, and eventually I went to the doctors. I got referred to the breast clinic the next day. They did a fine needle aspirate. They told me there and then it's fine, so I really wasn't worried about it. So eventually I went to the doctors, and they referred me to the breast clinic, and had to wait for ages because this was mid-COVID. And then I got diagnosed at the breast clinic. They did a biopsy, but they're like, it's cancer. So as far as spreading, the way yours did, they were quite confident it hadn't spread, but then they did an MRI and it was a lot larger than they initially thought, so had to do a CT scan, and again there was such a long wait just because of COVID. So it showed that it didn't look as if it had spread, but my lymph node looked a bit enlarged. So then it was more waiting to do a ultrasound, which looked as if it hadn't. It should be okay. So finally, after getting diagnosed in the June, it was the end of September before they finally did something, and it was surgery. They planned 2 surgeries, one to take it out and the second one to reconstruct a month later. Unfortunately, after they took the tumour out, they took a few lymph nodes to check them, and they were positive. There was also, they wanted to have a clear border around the tumour, but unfortunately there wasn't. It was right against my rib cage or chest wall, so that was a bit scary. That's when I was like, oh shit. So when I went for my next operation, they just took all my lymph nodes out. But there's always been a clear kind of path of how they're going to treat me, because it was relatively uncomplicated. So got chemotherapy, radiotherapy, and the tumour I have, it grows on estrogen. So I'm on tablets to just get rid of the estrogen, and injections every 4 weeks that stop my ovaries. So it's put me into like premature menopause, which isn't great, but the alternative, at least there's targeted treatment I can get, so it's better than nothing, do you know?
Yeah. And Alice, I know you've talked a lot in the past about the complexity of cancer biology, and the complexity of conventional treatments too. And we've heard, Christian's story, there's a lot of treatments being brought up there, some treatments, effective, and then they lose effectiveness, and then you have to go on to a next one. It's quite a complex journey for people to go on. To what extent do you think that complexity of conventional treatment might play into the seductive quality of alternative medicine, these alternative cures?
I think this is it. I think that there's a big problem in the sense that cancer is an incredibly complicated set of diseases, and I don't like to say, cancer is cancer. It is hundreds of diseases. There are hundreds of different types of cancer, and every type has slight variations in how those cancers progress, how they develop, which different proteins are involved in regulating that cancer. So like you say, yours is estrogen fed, and that means that we can start to target the estrogen receptors. We know that we have drugs that can target that, whereas with other cancers we have different proteins involved, some of which we've labelled undruggable because we've never been able to find medications that actually work specifically for the protein that's mutated in that cancer. So there's lots of complexities in how we select options for treatments, and we basically don't know everything we need to know about cancer just yet. There's some we know a lot more about, and some that we know how to treat a lot better, and some that we really struggle with, and that can be very daunting and scary for people as they find out which types of cancer they have and go off to Google it and try and find more information. But I wanted to touch a little bit on something Crispian was pointing out as well, in that we also have cancer is not a static thing, it is constantly changing. So in patients where you have a tumour and you can remove it, that's one thing because you've taken the cells that are replicating with the problem that's causing the cancer out of the body. But there's other cancers that we have to treat kind of in situ. And there's a really nice example of this in chronic myeloid leukemia, which is a cancer of the blood. So you can't remove a tumour because you need your blood, you've got to have it there. But we know chronic myeloid leukemia is almost always caused by a very particular genetic mutation where 2 chromosomes swap bits of their DNA structure with each other, and they create a new protein that doesn't exist in normal bodies. It only exists in this form of cancer, and so we can design very special drugs that target that particular protein. And those drugs are amazing. For about 80% of CML sufferers, this drug basically cures them. It's a fantastic medication, except cancer is always under this selection pressure where it will start to get mutations, acquire new mutations, and one of those mutations might just change the structure of the protein sufficiently enough that the drug no longer binds, but it can still do the thing that it's doing to cause cancer. And so patients have to go on to a second or third line treatment, and it can feel like this very, very long process of constantly getting checked and making sure that your medication is still working, which I can imagine, Crispin, is exhausting when this has stopped working again, right?
Absolutely.
So I can see why that would then for patients be, well, you're telling me this might work and it works really well. It's a really great drug, but it might stop working after a while. These alternative practitioners are telling me they've got the cure, they've got the answer, and all I have to do is X and I will be perfectly fine. And that makes a big difference, is the certainty that can be offered. And again, I think, Crispin, you touched on this, that your doctors have given you realistic expectations, and I'm guessing that's the same for you as well, Laura, that they manage your expectations carefully. Alternative therapists are much more likely to say, this is the answer, I've got the cure, I've got the magic pill.
Yeah, and I think the thing that, Laura, you mentioned that at every stage there was a lot of waiting. There was COVID going on, the NHS has got backlogs and things like that. And I guess that's also one of those seductive qualities of alternative medicine, is you're not waiting when you go to the thermography clinic who says, take this thing and then go to this homeopath or this herbalist. It's there, it's immediate, it's you don't have to wait for referrals and appointments and things.
And you want to hear reassurances. You just want somebody to say everything's going to be okay, and the oncologist wouldn't do that.
Brian, if I could bring you in. Brian, if I could bring you at this moment. During Laura's cancer experience, you actually turned to Dr. Google when Laura got her diagnosis. Could you tell us about the investigation that you went on and what you found? What was that like?
Sure, yes. I mean, spoiler alert, folks, the internet's not a great place for good information. But so once Laura was, I guess, past the worst of her treatment, right, which was fucking horrible, I was in like a space where I wanted to take that information or take that experience and try and find out something useful about it. So I took it upon myself to hop on board as many alternative health groups as possible on Facebook. Some very cancer specific, some more generic, and post essentially an identical message in each of them, right? And it was, my wife's been diagnosed with cancer, I'm terrified, what do you recommend? Do you recommend conventional treatment, alternative treatment, or both, right? I should have done it as a poll, all right? I would have got much more objective results doing that. But what I got instead was a flood of recommendations, right? And I would imagine like everybody in this conference has got their ideas of like, fake cancery stuff, right? I'll guarantee it's on my list. I've got A to Z except for the letter Y, right? So if anyone can complete my alphabet, I've got a numeric one as well. So pretty much everything, right? So like all the greatest hits of cancer nonsense was thrown in my direction. Also, a lot of direct messages from what I perceive to be con men, grifters, well-meaning members of the public as well in some cases as well, right? But, I can give you some highlights later on, but like, homeopathy, absolutely. Cannabis oil, Rick Simpson oil, that was big. Some gurus like Chris Ward, Chris Beat Cancer, Ty Bollinger, who's recently jumped over to COVID denialism and anti-vaccine stuff, and urine therapy, of course. You want to piss yourself healthy, they can recommend that as well. Gerson therapy as well, all of the best, right? So there was nothing that desperately surprised me. But the sheer volume of stuff I got, and a lot of it was copy-paste stuff as well, people who are clearly jumping across these groups, right? 20 groups I got to post in eventually, right? Because a lot of them I didn't get into or didn't get their post approved. And I got like just under 500 comments. Some of those comments were over 1,000 words, right? Now that's how much I have to write for a skeptics article, right? Which doesn't happen very often. So they go into a lot of effort to try and help or promote whatever nonsense they've got there.
Brian, were they particularly patients or family members of people who had cancer, or did you also get messages from people who sold and provided services and treatments for people?
Yeah, I mean, of course, it's impossible to tell, right? There was a few times when, oh, here's some well wishes. Oh, by the way, I offer this, right?
Yeah.
And I would say, like, when I was classifying my responses in scientific methodology, a lot of them were just well wishes. Just, hey, I hope everything's okay. Thoughts and prayers, which is fine. It was nice sentiment. But certainly, like, the more tenacious ones, the ones who have money to make, right? So, but absolutely everybody who DM'd me was trying to sell me something. Some incredibly persistent as well. The rest of them, I don't know. There's a lot of true believers out there. I'm still in these groups, right? And the posts still pop up, right? And it's, of course, fused in with all other kind of like alt health and anti-vaccine sentiment as well, and you still see it going on. But I think the majority of them are well-wishing true believers that just don't know any better.
Yeah. And so you mentioned about how lots of the people in those groups were other patients who were talking about the things that they were doing, that they were trying. Crispy and Laura, I don't know, during your experience, were you finding other patients who would recommend the treatments that they were trying, or things that were alternative, or were you getting recommendations for either alternative treatments or other unsolicited health advice from other parts of your life? What was your experience as you were going through these things?
So as I said before, all the stuff that I'd got, through the proper channels had been good. My oncologist is one of the leading oncologists in kidney cancer, because it's not one of the most common cancers. So he tends to do a lot of talks and a lot of conferences on kidney cancer and the latest developments. And my scans are now always used whenever he does a conference as the case study of how it can be.
You have a celebrity kidney.
My scans are now more well known than my face. Yeah. But one of the conferences he did earlier on, it's like a mini QED. There was about 4 or 5 sessions, and it got together a lot of the kidney cancer patients from across the UK, because we're a relatively small cohort of cancer patients. And one of the sessions that they did was on complementary care for cancer, and they talked about the usual sorts of stuff with aromatherapy and Reiki could help with pain relief. And that was the only time when, in a proper medical setting, anything like that had been pitched to me. But the encouraging thing that I got, everyone there at the conference sat through that particular talk. They didn't ask any questions. They politely sat through it, and they were there for Dr. Wheater's talk on the breakthrough in proper evidence-based trials. So I found that quite encouraging. But I personally live in a bit of a skeptical bubble, so I don't tend to see a lot of these things unless I go searching for them. And I feel a little bit like buying the Daily Mail to get outraged about immigrants when I go on the internet and I search for all sorts of ridiculous treatments that sound ridiculous to me when they're not in my sphere. But
some of us do that for a living, Crispy, and I wouldn't.
But I accept, though, that whilst for me, for the example of reading the Daily Mail is a provocative act, some people, that is their daily digest of information, and it's the same for the other information that they're receiving online through social media. So although my social media is actually very good, because I'm friends with people like you who don't suggest shoving a flat white up my arse, then it's not a problem. The biggest issue I've had with
so Brian has brought props.
Okay,
yeah.
That is a turkey baster and a thing of Nescafe is what you've just put on the table for anybody who can't see what Brian has just put on the table.
It's highly sensitive medical equipment. How dare you?
It's interesting you say about the conference you were going to, Crispin. I actually was invited to speak at a melanoma conference, so specifically for melanoma patients. specifically invited to talk about the ranges of alternative medicines that they might encounter, because what they found was while a lot of patients will be told, these are the types of conventional treatments and here's the other things you can do to help yourself, they're never warned about the Wild West that's out there, of the people who are like that Brian encountered on Facebook. And so I was brought in to say, well, if you hear this about Gerson, actually it doesn't work for these reasons, and to talk about the forces and the pressures that patients are put under to try and try these things. Laura, did you find yourself getting any kind of an unsolicited health advice?
Not much. I got plenty of leaflets from the doctors, and in the back of one of the leaflets it was talking about complementary therapy, as Crispian was saying about massages and aromatherapy. I had a few friends. I got a DVD from a family member that was all about curing yourself. But I just said thank you. I didn't.
Oh, I've seen that film.
That's the DVD that you were sent. Heal. It looks like it's called. Do you want to read the blurb there, Brian?
Oh, crikey. Change your
just a
mind,
short
change your body, change your life. Heal not only taps into the brilliant minds of leading scientists and spiritual teachers, but follows two people on actual high-stakes healing journeys. It's got Deepak Chopra in it. Come on.
I think I reviewed that film on GAM at one point on Good Off the Movies. I think that might have come up. And Alice, I know we've talked about this before. You told me about your mum's experience when it comes to unsolicited health advice, not just the alternative medicine claims that you've got to worry about. It's all sorts of other stuff as well.
Well, and this is the thing. So my mum was diagnosed with cancer about 12 months ago, August last year, and she's just finished her treatment pretty much a year to the day after that. And what's been interesting for her is, and I think this touches a little bit on what you've said as well, Crispian, in that she's making time to engage with other people going through similar things to her. So she's got friends who've been diagnosed with breast cancer around the same time as her, and they're sharing stories about the progress of how things are going, and making recommendations and saying, well, I tried this treatment and I really, really hated it and I felt really sick, which for my mum, she's pretty rational, she's pretty science-minded, she's pretty convinced she wants to go down the conventional treatment route, which is great for me because I don't have to have any difficult conversations with her. But she's also got new health anxiety because she's always been a very robust person, and now she feels very anxious about things going wrong. And she's got friends in her life who are saying, well, I took that medication and I couldn't walk and I felt awful for weeks and weeks at a time, and then that increases the anxiety. And then there are recommendations. Thankfully, everybody that she's been talking to is also going through the conventional route, but there's other options that are offered to her, complementary things, as you say, things like the cold cap to prevent hair loss, which has some evidence, but it's still very, very early days.
I used that, but I wasn't aware that it was. I just assumed there was evidence because I was getting offered in the NHS.
Through the
Just
NHS.
explain very briefly what that is for people who aren't aware of it, because I've never come across it before. Either of you.
Well, you've used it. Do you want to explain it?
It's just like a swimming cap that's like insulated and it's been shoved in the freezer. So it's the theory behind it is it stops blood flow to your head. So when you're going for your chemo, you put it on half an hour before you start your treatment, and
so the chemo doesn't get into the hair root. So hopefully you don't lose your hair in the same way as you would otherwise.
I was warned some people find it really painful just because it's so cold. I didn't find it too bad. The worst thing I found about it was you had to start earlier. It made your chemo session longer because you had to keep it in at the start and at the end for an extra time. The nurse did warn me. She did say, best case scenario, you're going to lose some hair. It's just, if you've got really thick hair, you might be left with some. So I did it a couple of times and I was just like, it's just horrible, your hair falling out. It's just such a physical, because up to then I looked absolutely fine, It's like nobody would have known I was sick, and then suddenly you're just like, So one night I just said to Brian, it's time to shave it off.
Yeah, like when I started going bald, I had a fun time with my friends shaving my hair. It was much more sober. It was not
no
a fun
mullets
night.
in between, no.
Yeah.
But I think that effect on the effect that conventional treatment can have on people's health as they go through it, the side effects, that can also be one of the pressures that drives people towards alternative medicine, and it's also unfortunately one of the things that gets used as a success story for Gerson therapy or something like that, because to do Gerson therapy you come off your chemotherapy and therefore you stop suffering from all the side effects of chemotherapy, and you get cancer patients saying, well, I feel great, I feel better than I've felt in months. So because you're not doing the treatment that is making you feel unwell, but it's also making your cancer feel even worse. And so that ends up being one of the things that these incredibly powerful patient testimonials is based on, is that these people feel better. They become testimonials on the website of the clinic who's given them Gerson therapy, and those testimonials stay there even if their story doesn't turn out to have a happy ending, and it's very difficult to get them to take those testimonials down afterwards.
When we went undercover to see somebody speaking about Gerson therapy, and one of the things that they say is that it's very important that you stop taking all treatment when you go on Gerson therapy, but that you also stop having any scans when you go on Gerson therapy. So you have no way of monitoring how things are going. You feel better. You're being told by your alternative practitioner that things are going well and you're getting better. And then maybe 6-9 months down the line, they'll do a thermographic scan instead of sending you to a proper medical scan. And thermographic imaging for cancer is absolutely not evidence-based. It is not a good way for tracking the growth of cancer, which means they can say your cancer looks better than it did before, that our treatment is working, but you're not getting a proper evidence-based scan.
Yeah, and the problem with those false diagnostic techniques, actually, it works in that way, in the sense that you can't see how bad it's getting, but also works the other way, where people will do a scan that doesn't work very well, see that they have a lump that they think is cancerous. They will then go off and have Gerson therapy. They'll do another scan and there's no lump there anymore because there was never a lump there in the first place. So now they think they've cured cancer, but they never had cancer in the first place, and now they end up sort of selling these services to patients who really have diagnoses. I think I'm going to take a question at this moment, and then we'll come back to the panel. Your hand went up over there, but I really can't be bothered to throw it that far right now. To be honest. I've had a long day. I'm going to go this way for a bit. So if I throw it to you, Sadar, and then you can speak into the top of it there.
Thank you for sharing your experiences. It's quite valuable. I mean, I'm sorry about the experience itself. Anyway, my question is, I know we have no enormously enough sampling for that, and equals 2 is not enough. But do you think if there's a gender specific difference between, women cancers get more quickly, male cancers get less quickly? It's some sort of difference between this kind of targeting.
Yeah. Do you have any opinions on this? Brian, did you see this in your Facebook at all? Or?
I didn't attempt to do a gender split or anything, depending on recommendations. I don't know. I mean, I suppose, like, if you're a manly man and you have cancer, you want more manly solutions to it, right?
You're going to Rick Simpson's oils, aren't you?
I mean, toxic masculinity is probably not going to help, right, your cancer, but, let's have something dramatic, and maybe something more floral and whatever. I genuinely don't know.
Because this kind of healed kind of documentaries, for instance, targeting specifically wellness and women.
Alice, you could probably speak to this from a wellness perspective. I've got some thoughts too.
But this is interesting. I don't think I've seen that much of a gender split in the alternative cancer spaces so much. I don't know if you've noticed more of a gender split.
I think it's changing. I think for a long time the alternative medicine industry was very heavily targeted towards women. I think that's starting to have changed over the last kind of 4 or 5 years, maybe slightly longer, as they kind of realise they've got an entire other half of the population, or whatever percentage of the population that they could be targeting. I know that when I was looking through the various fundraisers for people who were raising money to go to various clinics, I did think there was maybe a 60-40 split in terms of women to men in there. I think I suspect these days the pseudoscience doesn't really discriminate, partly because cancer doesn't discriminate, and the fears and the uncertainties and the just being scared of it all, that doesn't really go by a gender split. I don't know if anyone has any other thoughts on that. If not,
I think this. So anytime we've been to various different. Been in various different audiences where the speakers are speaking about alternative therapies, and the audience are predominantly people living with cancer and looking for options. A lot of the time, actually, as you say, they're talking very broadly about cancer in general, not making it specific types of cancer. The Yes to Life one I went to, I think, had more women than men, but the Gerson one we went to definitely was pretty evenly split, men to women.
I did attend a talk once from a proponent of Germanic New Medicine, which is essentially is blaming any ailment you've had on some kind of past trauma in your life. The audience there was like 80% female, like it was a high proportion, and it was a guy that was doing the lecture. He claimed to have had cancer and cured it himself like 10 times at least, he said. Who are we to disbelieve, right? But yeah, it was mostly female in the audience, right? Plus a couple of us and the Edinburgh Skeptics people, making notes and harumphing at the back of the room.
There's a question at the back of the room, so if you want to sort of pass it back to Rose. And I'll go over here next. I'm not neglecting this side of people, don't worry.
I'm not sure if, March, you're planning to cover this later, but what can we do about the lack of trust in the public healthcare system and the lack of the scientifically based treatments that are usually, in my opinion, my personal experience at least, a very large part of one of the sources of the good old-fashioned procrastination in going to find and going to see a doctor to get yourself checked out.
Does anyone want to sort of come in on that?
Well, I mean, Laura's already said, we had to wait a number of months, and I'm not sure how much of that experience was impacted by COVID. But we heard from Alice yesterday, right? In the case of not just cancer but many other things, getting to see a doctor's hard. Getting a doctor to pay attention to you can be problematic, right? And then getting a diagnosis can take such a long time. And then, depressingly with endometriosis yesterday, hey, we know what's wrong with you. Can't really do much to fix it. Let's juggle some dice here, right? So, all of those experiences add up, and then suddenly someone comes to you and says, we can fix it. We can fix it now. I can cure your cancer with carrots, okay? I've got a book right here, okay?
That's C on your A to Z.
Yeah, it's C on my A to Z, yeah. Or,
You've got 2 for C.
Yeah.
Coffee enemas as well.
Exactly, right. Or you can take some. I've got some homeopathic carcinosin here. This is a homeopathic cancer tumour.
I've got some of that as well.
Yeah. But initially,
and you have cancer, so
I made a noob error and bought the 30C stuff, and then I thought, I'm going to have to go heavy and go for the 1M, right? So this is really potent stuff here, right? And that's there, and it's right in front of you, right? I don't think there's probably nobody in the audience now who hasn't had a difficult experience with a doctor, right? And so the compulsion, particularly if you get a really bad prognosis, is like, all right, let's see what else is out there. What have I got to lose other than my life and all my worldly means and my kids' inheritance?
So I was going to say it's the time and the uncertainty as well with conventional medicine that's the scariest. I was more scared before I had my terminal diagnosis, when I didn't know what was going on, just waiting to find out. Once I'd understood and I've accepted things, that was much easier to deal with than just that initial few weeks and months of just being in the dark. And each time I have a scan, it's getting less each time, but it's still, there's a period between going to the hospital, getting the CT scan, and there's usually a 2-week wait before your oncologist and you get the results. And that period, the first time you do it, it's just so painful, just waiting for those results to come back and not knowing. And it's that not knowing that's worse than anything else.
Yeah, and I think in terms of that uncertainty... Sorry, I was something there.
I was just going to say, so I think just in relation to answer András's question specifically, it's often... sorry, I forgot what I was going to say.
Sorry, it might come back to you. But I think you mentioned that uncertainty being the hardest moment to be in, and I think that's also one of the things that ends up driving people to look for alternative answers, because while you're sat in the uncertainty of waiting to hear back from the doctor, there's a load of certainty coming at you from so many different places. And I remember when I was starting to look into the ways that these stories propagate through society, it can feel like there's this that you're bombarded. I can imagine it would feel like you're bombarded by so many different people who are trying to say, well, a friend of a friend had this advice on cancer, and I read this in this magazine, and I saw this in the newspaper that someone tried this, and it can all feel like independent lines of people recommending something, but people don't necessarily realise that it was in the magazine which inspired the person who was in the newspaper, and that's where your friend read it, and that's what they're talking about, and it's the same bad messages rebounding around an echo chamber while you're waiting to hear a good message. So I can imagine that has quite a pressure on people.
And just to feel as if you're doing something rather than just sitting waiting for your results. If you're actively doing your research and looking for other things, then maybe you don't feel so helpless.
I think this is one of the key things, is that we're talking now about like what happens once you've got the diagnosis, trying to go down and finding who you can trust, who you can talk to, where you get your information from. I think one of the key things when it comes to such a scary diagnosis as cancer is actually people need to be prepared long before they're hit with that diagnosis. And actually I think this is a question of good science and medical communication throughout society to try and demystify cancer and to try and make that complexity of it more understood before you ever have to process it for yourself. Because once you're processing it for yourself, all of this is way too much information to have to go down. Having a better understanding that actually this is how complex it is, and these are the sorts of things that might happen if you go down that route, once you get there, would be a big help for a lot of people, I think.
Yeah. I'm going to take a question from this side of the room. So if the box could make its way over there, but
not Dave.
I just want to bring up at this point there are treatments that are put forward that will never say they're going to cure you, but they're put forward as adjunct therapies. They might make you feel a bit better. They might be relaxing, even though they're not evidence based. You can go and get some Reiki. It's not going to do anything, but it's not going to do anything bad either. How do you guys feel about those types of treatments, where it could give someone the sense of agency of at least I'm doing something, but at the same time, could that operate as a gateway into, once you're starting to accept some things that don't work, it's much easier for that Reiki practitioner to happen to mention that they know a herbalist who's actually could sort this out for you and that kind of thing. And how do people feel in that kind of area?
I think it feels into a sort of denialism that gets foisted upon you. That one of the hard things to accept with my cancer was just the levity of the diagnosis that I received, and I thought it was helpful to accept what was likely to happen to me. I know my argument's slightly undermined now by the fact that I haven't died, as told I have, but being prepared for that I found helpful. And a lot of the misinformation I got was not necessarily, or try Reiki or try aromatherapy. It was more along the lines of, oh yeah, I knew someone who had cancer, and yeah, he was really bad and he was going to die, and last year he climbed Mount Everest and he's fine now. And they don't know what sort of cancer he had. They don't know what sort of cancer I've got. What my diagnosis is. It's just suggesting you to not accept the reality of your diagnosis.
Anyone else want to comment on the adjunct therapies question before we take the question from over there?
I think there's one thing that you and I have talked about before, in the sense that there's this idea that I'm a big believer in people should have agency and be able to take control of their situation, and if that means taking something that doesn't work but just makes them feel better, I think that's really important, as long as they're keeping the door open with their health practitioner and doing things safely, and always sharing that information in case it interacts with any of the other medications that they're taking. But there is one concerning element, in the sense that while we can regulate the claims that are made on alternative practitioners' websites or in their promotional material, we can't know what is being said to patients behind closed doors. So I had a particular example recently where you sent me actually a crowdfunder that you'd come across and asked if the science behind this alternative therapy was legit. So I looked it up and I went on their website and I put my details in so that I could download the brochure. And they sent me the brochure immediately, and then they called me every day for like a week trying to get in touch with me to talk to me about this cancer treatment that they were offering. After a while, I said, I'm not going to be available until the end of August. She said, okay, I'll call you back at the end of August. And then she called me every day. She sent me WhatsApp messages to try and get in touch with me. And then she called me every day to talk to me. And eventually I managed to, because of course at that point I'm like, and now I definitely want to talk to you because you're this determined to talk to me.
Yeah.
So I spoke to her on the phone and I recorded it, of course. And I told her about my mum's cancer. She said, why are you interested in this? I said, my mum was diagnosed with cancer about a year ago, and she talked to me about all of those sorts of things. But one of the questions I asked her was, what do you believe that my mum should stay on the treatment that she's taking? She's already taking cancer medication. Do you think she should stay on that? And she said, well, I would always say that you should go ahead and stay on treatment. But you can talk more in depth of that with the consultant when we sign you up with the consultant. And I very much had the impression that actually once you get into the private conversation with the consultant, the information is going to be very different, because at that space they're not being regulated in the same promotional way. And we've seen evidence of that in other cases. This is me predicting how that conversation is going to go. But
yeah, well, there's an example of that I actually wanted to bring up, which was that for a while the NHS in various parts of the country, while it was funding homeopathy, which someone stopped, but it was also, I wasn't doing that for applause. No, we haven't got time for applause. It was also funding mistletoe therapy for cancer patients, and what it was saying in the consultations that they were getting to get the contract signed was that mistletoe was good for the side effects of chemotherapy. It was good for nausea and for chronic pain and fatigue, and there's no evidence it does any of those things. But I do know that the practitioner who was given the contract to give Iscador on the NHS for the side effects of chemotherapy is also someone I found in the autopsy report of a cancer patient who died while getting mistletoe injections that were and he's on record as saying, we give out mistletoe injections because they shrink cancer tumours. They kill cancer cells. And this is an NHS doctor who had a contract with the NHS because we just give it to people for the side effects of chemotherapy, but once you're in the room with them, it kills cancer.
The evil whispery guy in Lord of the Rings, right? You're getting his Reiki treatment and they're going, it's going to kill you.
Okay, has the box made it over there? It has. Fantastic. What's the question?
Yeah, hi. So I've just recently retired, but I was a cancer surgeon for 20 years in the NHS, and I can probably deal with cancer patients for 25 years plus. And as a surgeon, you basically see them from initial referral through treatment. Most of it's surgical, with adjuvant treatment. Some of it is non-surgical, but I followed them all up as well. And really, in 25 years, I can remember 2 patients who ever had some involvement with alternative treatment. One was someone who had surgery, radiotherapy, and crystal therapy, and had a very good outcome from the cancer, surprisingly, which she put out to the crystal therapy. And one other patient who, unfortunately, went for homeopathy and actually ended up died of the cancer. But other than that, having seen them, do you have any idea of how many patients really actually who've got verified cancer then do not undergo conventional treatment and just eschew it completely and go for completely alternative treatment? Because my experience is once I've got the diagnosis, and I don't even hear it from my colleagues in that time as well, saying, so this patient went off. So I don't know if maybe Marsh or Brian or anyone who's sort of investigated the alternative side of things have any idea of how many patients with a proper diagnosis of cancer have genuinely rejected
there was a study,
treatment.
right?
If you know the details of the study, feel free.
Off the top of my head, no chance. I've got a slide somewhere I'll show you. Yeah, but like I don't think it goes into actual numbers of patients, but it looked at like cohorts of patients diagnosed with cancer and whether they went for conventional treatment or whether they went for alternative, and it looked at the survival rate after X amount of months and what have you, and you can see the survival rate drop off significantly for the alternative treatment. But in actual numbers, I don't know.
Yeah, I don't have numbers in terms of the prevalence or the incident rate right across the country. I can only give sort of small snapshots. So the investigation I did in 2018, when I was just combing through every single crowdfunding site, so these are people who've obviously made the decision to go to alternative medicine, I think I found something like 320 stories for 320 people who I could say were definitely cancer patients who were definitely going to get therapies that definitely don't work. And I think of those 320 stories, I was able to track, I think it was something like 150, 160 obituaries that I could find online. And of the 300 plus that I found, more than 100 stories were covered in the media as this person cured their cancer, this is a miracle cure. And the saddest thing that I found throughout it, most heartbreaking thing, was that I could find people whose story was in the media as a miracle cure, who were named in other people's crowdfunding campaigns as the reason they are going to the same clinic. Yeah. And by the time that second person is going to the clinic, I've already seen the obituary that the first person has died. But they still are in the media as a story, as a success story, and their success story outlives them and continues to persuade people. So I can't give you a number in terms of the entire country, but in that snapshot, we were seeing quite a lot, and finding. Not everybody puts their obituary online, and this is just the ones that I could find a link to. This person unfortunately didn't make it.
Just another very small snapshot. When we went to that Gerson therapy talk in Liverpool, so just one city in the UK, there were at least 100 people in the audience, and the majority of those people were cancer patients who were very interested in Gerson therapy. And Gerson therapy very much pushes you towards stopping all conventional treatment. There were certainly people in that room who were stopping all conventional treatment.
And who were told by the practitioner, he asked them, what chemotherapy are you taking, by name, and when they said the name of that drug, he said, no, you can't take that anymore. My thing won't cure your cancer if you're taking that chemotherapy drug. So, I think we've got like 1 minute left. So just to end, I just want to say, we've talked about like the advice that people get, and even I think some of the pressures as to why people look for these things. And I think a lot of the advice people give in unsolicited ways, whether that's alternative medicine or not, is partly because they want to do something to help you. They want to recognize that you're hurting, and they want to say something that will be helpful. So if people in this room have friends and loved ones who have cancer, what can they say or do that would actually be helpful? You've been through these experiences. What did people do for you that you actually did find was helpful in the moment?
I found just people being in touch, because I think with cancer it's a bit of a taboo, and I don't really understand why, but people are like, oh, well, I talked to her, but it made me feel really good. There was people that I didn't think I was that close with that became really good friends just because they were reaching out and just do you want to go for a coffee, or just say, oh, I'm thinking about you. I get some lovely wee hampers when I was going through chemo, which was in the skeptic community. We got this absolutely awesome hamper from, was it Skeptics Online?
Including some booze for me, by the way. Like, you don't need cancer to send me booze, folks, right? But humbled by the response from all of our friends and colleagues and stuff. And the best I took out of that was just, it's nice to know you've been living your life in a reasonably good way when, as I say, obscure people come out of the woodwork and say, what can we do? And even that, just that contact was gold for me as trying to support Laura.
Yeah. And Crispin, have you got anything to add there?
Well, perhaps one of the best things that someone did for me, I tended to go on quite a bit about my cancer and write about it. And one of the most helpful things that someone did for me is they gave me an Ockham Award, which was very nice.
That wasn't me. I only ever give it to myself. I don't give it to other people.
That is
the end of our panel for today. So please give a huge round of applause for your panelists today.